State of emergency. We're seeing it all over the headlines as monkeypox is making the spread across the U.S. Health officials say the number of cases is nearly doubling every week now. Cases so high in some states, their governors are declaring those emergencies.
Right, and California, Illinois, New York, they're all under this declaration of emergency for monkeypox. And the White House says it's watching the spread very closely.
We are considering every policy option to help end this outbreak. That is urgent and that is important to us.
When you hear state of emergency, you probably panic a little bit. I mean, hello, emergency is in the name of it, right? But doctors say when it comes to transmission, monkeypox is not the next pandemic.
The RO number, which is its reproduction number, is still quite low at less than 1. By comparison, COVID, the Omicron family, is probably at about 10 or 11.
Still, the virus is starting to spread across our state, and health officials say to slow the spread, we all need to be aware. Right now, the North Carolina Department of Health and Human Services is reporting 69 cases of monkeypox in our state, but that number was 0 just over 5 weeks ago. Taking a look at the states that declared states of emergency, the CDC says Illinois had 533 cases, California has 826, and New York has 1,617. The U.S. total is 6,326. That is only less than 0.00002% of the country's population. But even with such a small chance of getting it right now, you don't want this stuff.
I was like, oh God, please not me, please not me. Every sip, every bite, it's just like, oh, I can't, it hurts.
Wesley Wallace believes he caught monkeypox at a bar over the 4th of July weekend. It started as 8 different lesions on his chin, even one in his mouth. And he says it's spreading. Along with the pain and symptoms can come isolation.
The thing is, you look at it and it's such an ugly virus. You know, you look at it, you just recoil and you're like, oh, I don't want to be anywhere near that. I knew the stigma that might come with it, but I also know that lots of people are facing that stigma.
Despite the appearance of monkeypox and the physical symptoms someone with the virus may feel, very few people die. The World Health Organization says no one has died from monkeypox in the U.S. The WHO is reporting 5 monkeypox deaths worldwide, all of them in the Africa region. Wallace wants to let those with monkeypox know they're not alone.
Just let them know that they're not some kind of pariah, that they're not dirty, and that it's going to be okay. It's not lethal. It's just very temporary, and it's scary for the moment.
All right, with that, we have some good news and we have some bad news when it comes to the vaccine. The good news is there is a vaccine for monkeypox. The bad news is we only have so many doses here in the Triad, and the eligibility for that is limited. Right now, the Forsyth County Health Department is the only location in the Triad with monkeypox shots. They received the shot 3 weeks ago, and since then, they have administered, transferred, and scheduled appointments for all 460 of the doses that they have. They do say they are expecting another 360 doses tomorrow. The shot is appointment only. To get the vaccine, you must be gay or a bisexual man or a transgender person who has either had multiple or anonymous sex partners, was diagnosed with an STI, has taken PrEP to reduce the risk of HIV within the last 90 days. You know, as it turns out, the U.S. does have millions of doses of this monkeypox vaccine. They're just not here, as in like here. Let's verify what's behind this vaccine lag. To talk about the nation's monkeypox vaccine inventory, we look through the U.S. Department of Health and Human Services Administration for Strategic Preparedness and Response. We got information from Cody Kinsley with the North Carolina's Department of Health and Human Services. Let's talk about the Administration for Strategic Preparedness and Response, or ASPR. It is designed to be a leader when the U.S. experiences a public health emergency and to help us prepare for any health or medical threats. ASPR also oversees the Strategic National Stockpile. According to ASPR, the stockpile holds enough monkeypox vaccine to vaccinate millions of Americans if needed. But all those vaccines aren't in the United States right now.
They had a very small amount of it here in the United States because they were really planning for a very small smallpox outbreak. And they had a much larger portion of it in Denmark.
Kinsley says in the last few weeks, federal health leaders have been pulling those monkeypox vaccines from the Denmark location and then shipping them across the U.S.
So it has been a bit of a logistics challenge and for the federal government to work to do that.
Within the state of North Carolina, DHHS is allocating the doses it gets to a select number of local health departments.
We allocated it out to essentially a handful of local health departments to create a regional access point.
So it's true. The U.S. does have millions of doses of monkeypox vaccine and is ramping up to make more.
With such a limited number of doses and few people eligible, there are things you can do to help reduce your risk. The most important thing is knowing how it spreads. The CDC says it can spread to anyone through close personal contact, often skin to skin. But tweets like these on social media claim people can even get monkeypox just by touching clothing, bedding, and towels that have previously come in contact with someone who had the virus.
Can monkeypox spread through touching contaminated clothing and linens? Our sources are the Centers for Disease Control and Prevention, the Environmental Protection Agency, the New York City Department of Health and Mental Hygiene, Dr. Ilham Messaoudi Powers, chair of the Department of Microbiology, Immunology, and Molecular Genetics at the University of Kentucky College of Medicine, and Dr. Stuart Campbell Ray, vice chair of medicine for data integrity and analytics in the Department of Medicine at Johns Hopkins Medicine. Monkeypox transmission most often occurs through direct contact with a rash or sores from someone who has the virus. But people can get monkeypox by coming into contact with clothing, bedding, or other items used by an infected person, according to our sources. Dr. Ilham Messaoudi Powers says the act of putting on clothes and removing them can scrape the skin. So if somebody with active monkeypox lesions tries on clothes and then somebody else tries them afterwards, there is a chance they can contract monkeypox. She says the same logic applies to linens and towels. So we can verify, yes, monkeypox can spread through touching contaminated clothing and linens. According to both Drs. Messaoudi Powers and Dr. Stuart Campbell Ray, contaminated clothing and bedding should be cleaned thoroughly to avoid transmission. Both the CDC and the New York Department of Health say running a laundry cycle with detergent on the hottest setting should be enough.
When it comes to monkeypox and the triad, the spread is slow.
We want to keep it that way.